When your knee hurts, choosing exercises that can help resolve your symptoms depends on several factors. Let's look at some of these factors and explore some exercises that can be helpful. My name is Roxanne Meldrum, and I'm a physical therapist with PT Health Academy. If you find this video helpful, please take a moment to hit the like and subscribe button, as this really does help my small business grow. Thank you so much for your support. The first factor to consider is whether loading or weight bearing through the joint is painful. This is really easy to test. Stand with your feet shoulder width apart. Then shift your weight off of your painful knee, and then shift your weight back onto your painful knee. And if shifting weight or load onto that joint increases the symptoms, then that joint is what we consider load sensitive. In a load sensitive joint, you want to consider starting with exercises in an unloaded position, like laying on your back. This way your knee has a fighting chance to get through some exercises without aggravating the symptoms. Let me show you a few examples of exercises that I recommend in this situation. The first unloaded exercise that I would recommend is a quad set. You're going to tighten your thigh muscles, hold for 3 to 5 seconds, and then release. Now, I started with a towel behind my knee because oftentimes when your knee is sore, it is painful to push it all the way straight. And I don't want these exercises to hurt. I want them to help your knee feel better. So if pushing your knee all the way straight is painful, then start with a small towel roll behind your knee. The towel roll can also help you with contracting that muscle because it gives you something to try to push into if you're struggling to get this muscle to work. The other thing to think about is it can be helpful to do both legs at the same time. So you can see what your good leg is capable of, and it tells kind of your brain and your leg what you are looking for on the other side. There is another reason why you might want to use the towel roll. If without the towel roll, as you do that quad set, your knee hyperextends, meaning your foot comes up off the floor, that's not really great for your knee joint, so you want to protect it from doing that. So keep your heel on the floor as you tighten that muscle and push down. Again, I would do 3 to 5 second hold and sets of 10 at a time, and as long as that's not painful, you can do 3 or 4 sets of those. This really helps to wake up your quad muscle. It also adds kind of some pump activity to the knee joint, so if you do have some swelling, it can help work some of that out. My second favorite exercise for a knee that is uncomfortable in a loaded position is rolling the knee with a ball. Let me show you. You're going to lay back. You're going to put your foot on an exercise ball, and then you're going to roll your knee back and forth. Do that little quad set at the end if that's comfortable too. All the way up and all the way straight, as much range of motion as is comfortable for your knee joint. This is usually pretty comfortable, so you can do a good 30 or 40 reps of this. Again, just activating your leg, getting some muscle pump, improving blood flow. The third exercise I would recommend if your knee is load sensitive is a clamshell exercise. This exercise helps to activate your hip muscles, get some good muscle pump through your leg, blood flowing in an environment that is not as irritating to your knee. Let's look at another factor that can cause knee pain. Let's say you have pain walking downstairs or down a ramp. If you watch your knee, do you find that it caves in with every step down the stairs that you take? Unfortunately, that cave-in is pretty common, and it's really hard on the inside surfaces of your knee as well as the surfaces behind your kneecap. In this case, exercises that help to strengthen your hip, done in front of a mirror, can really help to develop some control in your leg so that your knee stays straight as you step down those stairs. There are 2 exercises that I really love for this situation. The first one is a split squat. I like to use a pad to give myself something to aim for. And again, you want to do this in front of a mirror. As you come up and down from the split squat, you're going to watch your front leg in the mirror and make sure that your hip, your knee, and your ankle stay in good alignment. What often happens is it will either cave in or it will be really wobbly. And you want to develop nice, strong control up and down from that position. The second exercise I like is a lateral lunge or slide exercise. You're going to slide your uninvolved leg out to the side as far as you can, and then work on that painful leg, again, looking in the mirror to make sure that your hip, knee, and ankle stay in line through the motion. Now, most of my weight, 90% of my weight, is in my right leg, and only about 10% is in my left leg. So my right leg is doing the majority of the work. And again, I want to watch in the mirror and make sure that my leg is staying straight and not caving in or, again, wobbling as I move up and down. Let's look at another factor. It's common to have pain in your knee after prolonged sitting. Maybe it's a little achy while you're sitting, but then you go to get up and those first 5 to 10 steps are really painful. This problem responds really well to moderate exercise that helps lubricate and nourish the joint surfaces that have gotten sticky from prolonged sitting. For this series of exercise, you're going to need a stretchy band. You're going to tie a knot in the band and close it in the door, loop it around the back of your knee, and then stand up nice and tall with your feet shoulder width apart. You're going to let your heel come up and then push it down by tightening your thigh and squeezing your butt. And you're going to set a timer and do this for about 2 minutes. If you want to count, you're aiming for anywhere between 50 and 60 repetitions. Now, if this is painful, you can shorten up the range or lessen the tension. But if this feels comfortable to you, back it up, add some tension, and do some work. When the 2 minutes is up, you're just going to turn around. Make sure that that band is above your kneecap. Add some tension, and you're basically going to do the same exercise. Heel up, tap it down. Control the extension. Don't let the band snap you back into full extension. Nice and slow and controlled. And again, if it's painful, you can shorten up the range. If you don't like going all the way straight, just stop it before you get to that painful range. But every once in a while, test it, because as you lubricate the joint, it should start feeling better, and then you may start to tolerate full extension again. The third exercise I like in this series is the exercise I already showed you, laying on your back, putting your foot on a ball, and rolling it back and forth. Again, that's a nice repetition of nourishment for the joint that can really help it feel better. 2 minutes on that one, or 50 to 60 reps. If you do 50 repetitions of all 3 of those exercises, that's 150 repetitions to help nourish and lubricate the joint surfaces in your knee. And especially if you can keep every one of those reps pain-free, that's some really good medicine for your knee. I hope that you can see from these examples that it's important to understand why the pain in your knee is occurring, so you can choose exercises that help structures heal and avoid exercises that aggravate your knee and cause more problems. Keep in mind that if your initial attempt at exercise to help your knee is unsuccessful, please understand that this does not mean that your knee is beyond repair and you are doomed to constant pain. In the coming weeks, I'm going to post additional videos to discuss the common causes of knee pain and good strategies and exercises that you can implement to help resolve your symptoms. Thank you so much for watching.